Today's important article is What is Lost and Gained in NFHS 6, written by Arima Arora. First of all, the Union Ministry of Health and Family Welfare released the preliminary fact sheet of 6th round of National Family Health Survey, that is NFHS 6. It is conducted by International Institute of Population Sciences, and NFHS serves as a multi-round, large-scale snapshot of India's demographic and health indicators. But this article tells us that there has been a shift from NFHS 5 to NFHS 6, and this shift is a structural shift. The key fact sheet has condensed to 101 parameters, and earlier there were 131 parameters. So basically they have dropped 43 parameters and added 13, and there is a net loss of 30 parameters. Now first let's talk about the gains, the positive trends. Survey indicates positive trajectories across structural, maternal and welfare domains. First is child nutrition, maternal care and institutional births and women's internet usage. There have been some improvements that the NFHS 6 shows. It shows that there has been a significant reduction in child stunting, and NFHS 6 recorded a drop of over 6 percentage points, a much faster rate of decline compared to the modest 3 percentage point drop between NFHS 4 and 5. The second one is maternal care and institutional deliveries. There's a clear progress in structural healthcare delivery with an increase in institutional births and a 7% point increase in mothers' access at least 4 antenatal checkups. Then comes gender empowerment and digital inclusion. There's a sharp rise in women's internet usage. Notably, it has been leaping from 21% to 63% in states such as Andhra Pradesh. Now, the most important point is the negative trends. Now, what is worrisome is that exclusive breastfeeding for infants under 6 months, it has fallen from 69.5% to 41.2%, for example, in states like Haryana. There has also been some family planning shifts which are visible in the reduction in usage of contraception, which dropped from 56.4% to 52.7%. Another point of concern is also that the share of women classified as overweight or obese has increased in every single state. So this paragraph becomes very important because it talks about health insurance, which has risen the most in West Bengal from 33.7% to 88.2%. Then internet usage, which I have already talked about. Then Haryana's breastfeeding has fallen, and then women's obesity has increased. So this paragraph is very important. Also this point that there has been an increasing obesity trend in every state among women. It points out that non-communicable diseases are on the rise, especially among women. Now the most important thing about this article is the deliberate omission of critical long-running socio-economic databases. First is anemia, which has been entirely removed from fact sheet. The second is demographic vital statistics. For example, their infant mortality rate, under 5 mortality, sex ratio at birth have been omitted. The third is infrastructure and welfare data on sanitation and clean cooking fuel. It has also been omitted. These are linked to the Swachh Bharat and PM Ujjwala Yojana. These have been dropped. Then the healthcare screenings, like the cervical, oral and breast cancer screenings, have been omitted from the National Family Health Survey 6. Now, first reason that the government gives is about data harmonization. The government argues that these indicators are already captured comprehensively by alternative administrative data sheets. For example, sample registration system. This is for mortality, and respective ministry databases for Ujjwala and Swachh Bharat Abhiyan. The second reason is that there are methodological concerns. For example, in case of anemia, the government says that the method used by NFHS overestimates anemia levels compared to the standard venous blood samples. Government says that the NFHS used to measure hemoglobin from finger prick blood sample read on portable analyzer, which several nutrition researchers contend overstated anemia compared to the venous blood drawn by other surveys. Now the third problem is about data silo. While the SRS provides aggregate mortality rates, it does not cross-reference mortality against independent socioeconomic wealth inequalities, education levels or caste indicators, the way that NFHS does. Also, by dropping the cancer screening indexes and localized nutrition profiles, policymakers lose survey-based national figures which are vital for target-oriented and fiscal allocations. There are some gains also. For example, the government has added digital and financial literacy. There are new parameters mapping digital transactions and DBT penetrations. Then there's biochemical expansion. For example, HIV tracking, hepatitis B and C tracking, screening for childhood micronutrient deficiencies via dried blood spots,